Good morning, everybody. Welcome to CT Live. I am Taylor Kinsler coming to you live today from the NBC Connecticut studio. We have a lot to get to, so let's get started. Across Connecticut, more than 244,000 people have been diagnosed with COVID-19, and as many as 5% may have long-lasting issues. But what does the recovery process look like? I spoke with Dr. Subramani Seetharama about Hartford Healthcare's new COVID Recovery Center.
So what are some of the long-term effects that some patients have following a bout of COVID?
So this is a very new science, and there's not a lot of evidence-based studies because we haven't had a chance to review a lot of this effects of COVID and post-COVID. So in the post-COVID recovery clinic that we are currently running, we commonly see symptoms of headaches, post-COVID headaches. If you've had migraine headaches, they seem to be worse. Fatigue, very common symptom. And I call it hypoxic fatigue from having your lungs affected and having low oxygen, or just generalized deconditioning and myalgias and fatigue. We see some neurological symptoms like weakness, maybe affecting one side of the body, maybe affecting the arms, having some difficulty walking. One of the common symptoms we see with folks is brain fog. So it is a loss of focus, loss of concentration. I had one patient whose voice volume was really down. She could not produce a loud voice because she couldn't breathe and speak at the same time. So those are some of the common things that we are seeing in the post-COVID patients.
And tell us more about how Hartford Healthcare's COVID Recovery Center is going to help that.
So our administrators have looked way up in the future, and they have set up this great system of checking out these patients who are recovering from COVID. So it is a multidisciplinary program. It's a collaboration with multiple providers at different levels, medical providers like primary care physicians, pulmonologists, cardiologists, and also rehabilitation medicine physicians like me, neurologists, and behavioral health folks. And we provide a coordinated care and a personalized care for all the patients. And we offer you exams and interviews from your home, from the safety of your home, if that's what you choose, or in person, if that's what you choose.
Now, for our viewers who are watching, when should someone consider calling the COVID Recovery Center for help?
So I always tell my patients there is never a dumb question and never you should never be in doubt. So if you've had COVID and COVID-related symptoms and you're struggling, like you're short of breath, simple things like walking up the stairs, bringing in your groceries from the grocery store. If you're having headaches and you've never had headaches before, if it's affecting your sleep and you're having sleep dysfunction, I have a lady who was very energetic, working full time, but now takes naps during the afternoon because she's exhausted by the middle of the day. Those are the kind of symptoms that if you are having and you've had COVID, then you should definitely seek some help so we can evaluate you and see what's going on.
Now, I know we've talked a lot about what leads up to someone being admitted for symptoms related to COVID and maybe even treatment, but we haven't really talked a lot about recovery. So what can rehab medicine do for a patient who is recovering from COVID?
So that's a very good question. So like I had mentioned, it's a multidisciplinary program. So when I see a patient and evaluate a patient, we try to figure out what the symptoms are, whether it's physical, whether it's neurological, whether it's cognitive, and whether it's a combination of all three. So based on the evaluation, you might be a good candidate for physical therapy where they can work on your conditioning, decrease your fatigue, do some range of motion and stretching and some strengthening if you have some weakness in your arms or legs. Work on respiratory stretching and respiratory exercises, which in coordination with our pulmonologists can help improve your shortness of breath. Some of these patients have significant chest pain related to post-COVID symptoms, so those kind of exercises help. Occupational therapy can work with arms, weakness in the arms, coordination, and any simple activities that you do at home like brushing your teeth, bathing, those kind of things, and they can help with that. Speech therapy is very, very important in post-COVID because they can help evaluate your brain fog, and they can give you strategies to help with improving your memory, your focus, and your concentration. We have some post-COVID patients who might have swallowing issues, and speech can work with that. They can work with voice volume. So as a rehab medicine physician, my job is to triage and figure out what kind of deficits you're having and get you to see the right physical therapy, speech therapy providers. And we also pride ourselves to give you access as soon as possible. Right now, we are trying to get you in within 24 hours of you calling into the COVID Recovery Center.
Well, Doctor, thank you so much for your time this morning and for sharing some of that information. We appreciate it.
Thank you for having me.